As the world marks Tuberculosis Day today, Programs Manager for the National Tuberculosis Control Program, Dr. Tuberculosis, has told JoyNews that the country's detection rate has dropped by a whopping 15% as a result of the pandemic. In the year 2019, the Ghana Health Service recorded over 14,000 cases of tuberculosis, but the outbreak of COVID-19 last year negatively impacted its detection and diagnosis, bringing the number of detected cases to 12,000.
We put in one of the best strategies in the world in late 2019, and we had a lot of cases. So by the end of 2019, we had gotten about 14,600 TB cases. That was quite substantial. It was almost 15,000. And at the beginning of the first quarter, or at the first quarter of 2020, COVID set in. So what happened? People will not come to the health facility. People will, even if they will come, they will not disclose that they were coughing. And you and I know why. Because at that time, it was a high stigma, because people were afraid to be stigmatized that they were having COVID. And as I'm informing you that COVID and TB, the symptoms are similar. Okay, so as a result, patient OPD attendance dropped. And so we could screen less, and the diagnosis, people that we diagnosed, we got about 12,433 as a result of that. And mind you, in some countries, TB cases fell more than 20%, but for Ghana, it was about 15%.
Well, speaking at the same press conference to mark the day, Dr. Tuberculosis also further explained that the result of a pilot study conducted between January and March in Greater Accra, testing for both COVID-19 and TB, revealed that 9% out of 208 samples tested positive for TB, while 2% tested positive for coronavirus.
Preliminary results, ladies and gentlemen, from a pilot study in Greater Accra on testing for both COVID-19 and TB at the same time showed that out of the 208 samples tested for both COVID and TB from January to March 2021, 9% of them tested positive for TB, whilst 2% tested for COVID. In fact, it is significant to note that one of the cases among this result was a multi-drug resistant case, meaning the bacteria that were found in the sputum were resistant to our two main first-line medications, that is isoniazid and rifampicin. This clearly shows that anybody with cough, fever, or breathlessness could be having TB.
He's therefore calling on Parliament and other stakeholders to join hands in the fight against tuberculosis in Ghana.
We don't tackle TB only from the technical point of view. We need the political will. Members of Parliament should be part of this. We must sing the song. We have brought the evidence indicating that TB is real. When we are talking about TB, a COVID suspect, you find TB even among COVID suspects. Therefore, the political will must come in. The stakeholders, civil society, must then come in. We roll out on the partners. As I speak now, TB, we don't have a lot of partners.